When you see a patient in a particular situation, there are lots of different frameworks for deciding what to do. The oldest one is evidence-based healthcare or evidence-based medicine, so-called EBM, where you take the best scientific evidence or data combined with your clinician judgment and, of course, the patient's preferences. That's been there really since the late 80s, early 90s as a concept, but it's been very much retrospective or rear view mirror stuff. As people realised that there were variations in outcomes for patients across different settings, across different countries, and maybe across different regions within the same country, the idea of quality improvement came about, whereby you follow the so-called PDSA cycle, which is where you plan, do, study, act, and look at particular health metrics, and you're continuously auditing what you're doing to try and improve quality. Another model that came about in the late 90s, early 2000s is so-called value-based healthcare, which is really about what do we value most in healthcare and how do we get the right care to the right patient at the right time. But also that was driven by data. And then more recently, this concept of the learning health system, which is where we have incredible wastage at the moment between what we know from science, what we have in evidence and guidelines, and what we have when we do our clinical practice in terms of data that's available. This is all changing with electronic health records and advances in data science so that you can connect up the science, the evidence and the care, and ideally have a continuous cycle which is continuously improving patient care using data at the coalface when you're facing the patient. So that really is bringing evidence-based medicine, aspects of quality improvement, and value-based healthcare all into the same model using the digital advances of this era. And whether it's precision medicine or whether it's trying to harness artificial intelligence, this concept of the learning health system is very helpful when we go forward to make clinical decisions.